Good morning. If you are here for the Breast Cancer Awareness Month proclamation, please make your way down. Come on down. Come on down. And we have quite a few guests with us today. So once everyone fills in the galley, come on all the way over. We want to pass the mic and introduce everyone that's with us. Since we won't have everyone speaking, we want to make sure we give our names and the organization that you represent. We'll start to the left.
Thank you. My name is Nguyen Nguyen. I am the Vice Chair for the Asian American Health Initiative Steering Committee.
Hi, my name is Sophia Yoon. I'm here for Asian American Health Initiative.
Hi, I'm Claire Doherty. I'm CEO of BREM Foundation to Defeat Breast Cancer.
Hi, we're Salcion and Keisha Martin Riley. He's Salcion Riley, and we're representing My Husband Fights Like a Girl.
Hi, I'm Shari Campbell, and I am representing Alpha Kappa Alpha Sorority Incorporated, Xi Sigma Omega Chapter, and I'm also a breast cancer survivor.
My name is Barbara Boney, and I'm representing Delta Sigma Theta Sorority, Montgomery County Alumni Chapter, and I am the president of the chapter.
Good morning. I'm George McFarland. I'm representing the African American Health Program.
Good morning. My name is Angela Powell. I'm the third vice president of Delta Sigma Theta Sorority Incorporated, Montgomery County Alumni Chapter, and I am a breast cancer survivor as well.
I'm Vicki Russell Walton. I'm a two-time breast cancer survivor. I am with the African American Health Program, and I am the cancer prevention specialist.
Good morning. My name is Valerie Forrester. I am the third vice president of the Eta Pi Zeta chapter of Zeta Phi Beta Sorority Incorporated.
Isabella with Creighton Services of Greater Washington, program manager and currently facing breast cancer.
Katie Smith with the Montgomery County Commission on Aging.
I'm Allison Stearns. I'm the CEO of Caring Matters.
Amy Fear, also with Caring Matters.
Hi, I'm Lee Bluestein. I am the Chief Communications Officer at Caring Matters and also a breast cancer survivor.
Hello, I am Oge Okeke. I am the Director for Cancer Prevention and Detection at Primary Care Coalition.
Hello, I'm Hilary Tsumba. I'm also with the Primary Care Coalition.
Hi, I'm Pat Grant. I'm with the African American Health Program.
Thank you so much for having this time and space with us to celebrate this important awareness month. My name is Laurie-Anne Sayles. You're at-large council member and member of the Health and Human Services Committee and the Economic Development Committee. We're also joined by my colleagues, Vice President Stewart and Council Member Balcombe as well. And we are going to hear from a few of our guests that are in attendance. First from the council members, followed by Ms. Oge Okeke, Director of the Primary Care Coalition and Cancer Prevention, Minister Dr. Shari Campbell, Lee Bluestein, and Claire Doherty before we read the proclamation. I just want us to keep in mind that just this year alone, over 300,000 women and almost 3,000 men will receive a breast cancer diagnosis. 1 in 8 women will face a breast cancer diagnosis in their lifetime. And the COVID-19 pandemic has shed light on the disparities in breast cancer treatments, with Black women in the United States being around 40% more likely to die from breast cancer than their counterparts. As a Gaithersburg City Council member and the only woman on the council in 2020, I spearheaded a breast cancer walk to raise awareness. Now, as a council member at large, I'm dedicated to securing funding for initiatives such as the Breast and Cervical Cancer Screening Program and supporting survivors and their families. And so now we will hear from Vice President Stewart before we turn it over to our guests.
Great. Thank you so much, Councilmember Sayles, for organizing us today. And I just want to say thank you to all of you for the work that you do day in and day out. And Cherie, I love your earrings. I don't know if people can see them at home, but they say hope on them. And that's what today is about, because we need to raise awareness about breast cancer. We need to make sure people are getting the screenings. And I'm sure, as Claire Doherty is going to talk about from the Brem Foundation, that they have the resources then to follow up if they get a diagnosis of breast cancer and they're able to get early treatment after early detection. That's how we're going to fight this. And I stand before you as a daughter, someone who lost their mother to breast cancer, a sister. My sister has had a double mastectomy, and as a mom, because I make sure every year that I get my screenings so that I can be there for my kids. And so I just want to thank everyone. Thank you again, Councilmember Sayles, for the proclamation today, and everyone for joining us.
Thank you, Council Vice President Stewart. Now we're going to hear from Councilmember Balcombe.
Hi, thank you all for being here. Thank you all for being here and sharing your story. I am a breast cancer survivor. I was diagnosed almost 15 years ago, and I can remember the calculation is easy because my daughter was turning 16 at the time, and it was touch and go as to whether I was going to be able to go to her party when she was 16, and that strikes my heart as a mom. And it was, interestingly, I just remembered that it was 9 years ago that I finished treatment. So it was a long slog, but I'm here today because of early detection. So I want to just press, please get your mammogram ask your moms, your sisters, your daughters to make sure they have their mammogram. For the men in the room, please make sure that you share that with the women in your life. 1 in 8 women will be diagnosed with breast cancer at least once in their life. So I want you to think about that statistic. There's in the 15 years that I've been a survivor, there's never been a time when I didn't know someone personally who was going through breast cancer. And I'm meeting some people today who have been through it. So when you're in a meeting, look around the room and think about 1 in 8. When you're at the football game, what does 1 in 8 look like in terms of how many women are going to experience this in their lifetime? And men. We have to make sure that we remember that men are diagnosed as well. So I just want to thank Councilmember Sayles for organizing this. This is such an important aspect. And for our providers here, thank you for doing that work. Thank you for everything that you do to make sure that we can continue with early detection and continue this fight. Thank you.
Thank you, Councilmember Balcombe. And now we're going to hear from Ms. Ogekeke.
Thank you so much. Good morning, everyone. It's a pleasure to be here with you all. Thank you so much, Councilmember Sayles. My name is Ogechukwu Okeke. Everyone calls me Oge. I am the Director for Cancer Prevention and Detection, and I serve at Primary Care Coalition, PCC. It's my great pleasure to be here with you all today because we all know that breast cancer kills, and that our best defense against its worst outcome is early detection and treatment. But for too many, access to mammograms is not a given. Fortunately, our county has invested in programs to help make sure that we all have access to breast cancer screening that we desperately need. The Montgomery Cares program is a public-private partnership that combines the efforts of the Primary Care Coalition, Montgomery County Department of Health and Human Services, 11 safety net health centers, 6 hospitals, and a network of private providers to care for uninsured neighbors earning at or below 250% of the federal poverty level. Montgomery Cares covers mammograms for women age 45 and above, and PCC and our clinic partners have worked really hard to make sure that participants get that. In fact, breast cancer screening rates in Montgomery Cares program are a prime example of what is possible with a concerted collective effort to improve healthcare access. The average screening rate for uninsured women aged 50 and above in Montgomery Cares program rose from roughly 40% to nearly 60% between the fiscal years 2013 and 2023. And it surpassed the average performance of Medicaid HMOs by 7% in the fiscal year 2023. This improvement reflects years of work by PCC and our partner health center clinics to serve our patients better. And it's especially important for the Black women that we serve, since we know that Black women face the largest disparities when it comes to breast cancer mortality. In our county, safety net care is not an afterthought. We work really hard to provide high quality care, including breast cancer screening and early detection, because everyone in our community definitely deserves it. Thank you.
Thank you so much, Ms. Ogekeke. And now we're going to hear from Dr. Sherry Campbell.
Thank you. Good morning, everyone, and thank you so much for this invitation. I stand before you today as a blessed 8-year survivor of stage 3 triple negative breast cancer. And if you didn't know, triple negative breast cancer is an especially aggressive form of breast cancer that is more common with women of color. Now, I guess you could say there's been a lot of advances, and there have been in research since I was diagnosed 8 years ago. But my message to you is simple today, that access to screening and treatment that is timely and early detection are important to increase the ability for women to survive this deadly disease. It's the good news is that there are about 4 million breast cancer survivors in this country, but sadly, there will be hundreds of thousands of people diagnosed by the end of this year. So what can you do? First, please get to know your body. Next, if you haven't scheduled your mammogram, please do. It's a momentary discomfort for something that could save your life. Next, be an advocate for yourself when you are dealing with the healthcare system. And as my dear departed pink sister and sorority sister, Darylyn Vassar Jackson used to say, use your voice. Thank you.
Thank you, Reverend Dr. Campbell. Now we're going to hear from Lee Bluestein.
Good morning. My name's Lee Bluestein. I am the Chief Communications Officer for Caring Matters. I want to extend my gratitude to Councilmember Sayles for this invitation. Breast cancer, like all forms of cancer, can turn your world upside down in an instant, and I can personally attest to this. I am a survivor myself, having been diagnosed with early stage breast cancer back in March of 2020, following a routine mammogram. I consider myself incredibly fortunate. Early detection made all the difference for me. My treatment journey was a process and not a grueling ordeal. However, I know that many women face much more aggressive treatments and need comprehensive hands-on support during such challenging times. That's where Caring Matters comes in. We're a 35-year-old nonprofit based in Gaithersburg dedicated to providing compassionate support completely free of charge for adults, children, and families experiencing serious illness like cancer, caregiving challenges, and grief. Our incredible network of trained volunteers offer a variety of services, such as companionship, emotional support, respite for caregivers, assistance with errands, and transportation to medical appointments. I'd like to share a quick, powerful story that illustrates the impact of our work. A few years ago, we supported a woman battling late-stage breast cancer who was also the mother of several young children. This family was in a tough spot financially, especially with unexpected medical bills piling up. While her spouse worked to support the family, they needed help managing the household and caring for the kids. Through our partnership with Bar T, we arranged free summer camp for 3 of the children, giving them not only childcare, but a chance to have fun during a challenging time. Our trained volunteers also visited the family several times a week, preparing meals and helping with light cleaning. Our mission was to lift some of the burdens from their shoulders, offering compassionate support and simply being there for them. At Caring Matters, we are committed to continuing this vital work, supporting individuals and families facing serious health challenges and tough medical treatments. If you'd like to learn more about our services, how to access them, or explore volunteer opportunities, please visit caringmatters.org. Thank you so much.
Thank you, Lee Bluestein. And we now will close with Ms. Claire Doherty before we read the proclamation.
Good morning. I'm truly blown away, I have to say, by not only the leadership of Councilmember Sayles and Stewart and Balcombe, but truly by all the organizations that are assembled here today. As we know, my mother was a breast cancer survivor. Breast cancer touches way too many people, but there's a whole continuum of services. There's early detection, there's treatment, and then there's support for people who are going through the painful journey. Brem Foundation to Defeat Breast Cancer is based in Silver Spring, and we are pretty much laser focused on early detection. We truly believe that the earlier breast cancer is detected, the better the health outcomes. But unfortunately, there are many barriers that stand in the way of many women finding their breast cancer as early as possible. Last week, we released the results of a survey with No Patient Left Behind that shows that cost is a major access barrier. And I would love to share that information with all of you because I think we all know that a woman should not, or cost should not stand between whether a woman can get her breast cancer diagnosis or rule one out. But truly, I'm just really pleased to be here. Thrilled to work with all of you, some of you in partnership now, some of you hopefully in future partnership, so that we can all push to address breast cancer and to ensure that early detection is a reality for all. And thank you so much.
Thank you, Ms. Doherty. And if we can give everyone a round of applause, our survivors and those dealing with breast cancer. And now we will read the proclamation. Okay. Whereas October is National Breast Cancer Awareness Month, breast cancer is the most common cancer for women in the United States, impacting 1 in 8 women over their lifetime and accounting for 1 in 3 of all new cancers for women. And
whereas in 2024, an estimated 310,000 women and almost 3,000 men will be diagnosed in the U.S. with invasive breast cancer, and over 42,000 women will die from it. And
whereas we recognize the disproportionate impact breast cancer has on communities of color and racial disparities persist in treatments and health outcomes. And
whereas Black women are more likely to be diagnosed with aggressive and harder to treat forms of breast cancer, require more time to complete therapy, and are more likely to die from the disease, with a 41% higher death rate than their white counterparts and the lowest 5-year relative survival rate of any racial or ethnic group, Black women must have access to affordable, culturally informed medical providers. And
whereas although there is a significantly lower incidence rate of breast cancer for Hispanic or Latinx women, breast cancer is a leading cause of cancer deaths for Hispanic women. And
whereas LGBTQ plus individuals with breast cancer face delayed diagnosis and treatment, along with a higher likelihood of cancer recurrence compared to their heterosexual and cisgender counterparts. These challenges exist alongside the disproportionate impact of breast cancer on Black women, highlighting the need for intersectional approaches to addressing disparities in care. And
Whereas there are a variety of genetic, environmental, and lifestyle risk factors that affect the likelihood of any person developing breast cancer. Prioritizing awareness through education and early mammogram screenings is critical in determining the most effective treatment and improving survival rates. Early signs of breast cancer may include changes in the look or feel of the breast or nipple tissue, as well as nipple discharge. And
whereas educating the public about the signs of early detection is crucial. Early diagnosis and treatment can improve the quality of life for individuals with breast cancer and their loved ones, with a 99% 5-year survival rate for localized breast cancer that is detected early and a 91% 5-year survival rate for all forms of breast cancer.
Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby declares October as Breast Cancer Awareness Month and as a critical time to improve healthcare access and reduce racial disparities. We encourage female residents to proactively schedule annual breast cancer screenings starting at age 45 and biannually at age 55. We are unwavering in our commitment to enhancing screening access for all residents. We urge everyone across Montgomery County to vigorously advocate for improved treatment, awareness, and research of this disease. Presented on this first day of October in the year 2024 by Council members Laurie-Anne Sayles, Marilyn Balcombe, Council Vice President Stewart, and Council President Friedson, and the entire Council. Thank you.